This tender point, this point is very tender and the muscle also very hard. Then we have to use yin side. Then between ear apex, when we go directly above, and from middle of forehead, when we are going directly back to DU 17. Then this middle point from 1 centimeter down, between this point is liver point. I make it with another color. Oh, sorry, I make it with the same color. This is the liver point. When we are going for 45-degree from liver point to upper side, like this, then there is a heart point, and it is the just before the sternocleidomastoid muscles. I make it with that, and when I go for palpating, then it is very hard, and the muscle also very tenderful point and hard. Then in inside, I put needle here. If the muscles is very soft and point is very hard, then I have to use young point here. And gallbladder point below this point here.
Prof, please unmute yourselves. Okay.
When I go 45-degree below, then there is the point gallbladder. And I make gallbladder very green, so it's visible to you all. This is gallbladder, and the gallbladder point is here on both sides. For putting needles, the indications are same. If the muscles is soft and point is tender, then we have to go inside. Otherwise, we have to go young side. Muscle is very hard, then we go for inside. Okay, then there is the point PC. This is on the directly, there is a crease in our neck from Adam apple to we are going for liver. Then the middle point is the point of pericardium, and I make it with purple color. This is point for pericardium, and this point is on this area here. Okay, then next point is lungs. This point is lungs. When you hook the muscles from back like this, then if it is painful, then the point is here. Okay, you have to hook Adam apple's near muscles on towards the pericardium point. If it is the muscle is very soft and point is very tender, then you have to put on this area. It is LE. L U H T, and middle point is PC, pericardium. And on front, here lungs is here. Then oh, sorry, I draw middle posterior brachial point, that is here. Okay. Then for next we are going on the small intestine point, then behind the sternocleidomastoid bone and the trapezius bone, trapezius muscle, where is the meeting point? There is the point, small intestine, this point. On inside, the point is two centimeter down here. On back side, the point is young side here. This is young side. Okay. After that, below that, on the trapezius muscle, there is the point stomach, and I will fill color for stomach. This point is stomach. This point is on the muscle of trapezius. When you are hooking the trapezius muscle like this on back side, then there is the point, and it is on the level of the Adam upper level. On young side, the point is here. On inside, the point is here. ST. Then PI. PI means spleen or pancreas. On the back side of sternocleidomastoid, the spleen point is at the level of the liver, pericardium, and lungs and stomach level. This point is on inside below the point of stomach here. On young side, inside young side is here. Then large intestine. Large intestine is next point, and this point is like this, and this is the point here, large intestine point. On this hairline, on back, the point is here. young side. Now, how you locate this point? When somebody is going upward like this, shoulder upward, then here is a notch. You feel on yourself. This is the large intestine point. Then next is Sengio. The Sengio point location. Almost you know. This is Sengio. And its location is here. Okay. Then urine bladder and kidney. The black point where I pinch, it is kidney point, and below it urine bladder point. When you are pushing on this area, and you see here is a muscles scaleni. This muscle is scaleni, and this is the head of where it meet with the clavicular bone. Then there is, when you are hooking down, then there is urine bladder, and when you are pushing it down backward, then there is kidney point. Then this is kidney, and right, this is urine bladder. Young aspect, there is kidney. Here is urine bladder, and above it is kidney. All points are clear now. Yes. Dr. Nita.
Yes, Prof.
Now everyone is understand with all the points and diagnose on neck area.
So let me unmute so that they can answer for themselves.
Then
You
unmute
cannot,
all.
yes, I've done that. You can unmute yourself.
It's clear.
On, please.
It's clear, sir.
Anyone
Very clear
have
to
any
me.
doubt?
It is clear, sir.
Well
Yes,
done,
it's
Prof.
clear. Yes, it's
I
clear.
have a
Thank you,
question.
sir.
I told you all this diagnosis is very important for PCM also. And this is the most important thing in the acupuncture field. This diagnosis is very perfect diagnosis. Abdominal and neck diagnosis is very perfect diagnosis. And the worldwide practitioner of acupuncture, although they are using traditional acupuncture, TCM, yin yang theory, they also use this point for diagnose. It is the most important thing to understand.
Prof.
There is
Hello,
any
Prof.
problem and you are not understand, then please ask me again and again. I repeat again and again. But I want you all are understand with this diagnose.
Hello, Prof.
Yes.
Yeah, that Adam apple, is it a pericardium or lung, sir?
Pericardium.
Okay, thank you, sir.
This is pericardium.
Hello, Prof.
Yes.
My question is that if we palpate that muscle, if the muscle is strong, are we going to needle the young?
Yes,
Or
the
if it is
muscle is
strong?
very strong. Muscle is very hard. Then you have to go for yin.
For the yin or young?
If the muscle is soft, then you have to use yin point.
Yes, it's clear now.
Hello, Prof.
Yes.
Hello, Prof.
Yes, yes.
Yeah, please, I have a clarification from you.
Sorry.
The
Yes.
usage of neck diagnose and abdominal diagnose.
Yes.
When exactly do we use each one? Like for instance, if
I
maybe the
told
person.
you, it is very neck diagnosis is very easy, and it is no need of undress. When you are going for a lady treatment and you want to do abdominal diagnosis, she may not understand with you, and she not want. Then what you do? But on neck diagnose, you can do easily. So I think neck diagnosis is good than stomach diagnose, abdominal diagnose. You can go and go through any diagnose, no problem. But neck diagnosis is most easy because there is no need to undress and no need to laying a patient. If you have a little space and your patient is not able to lie, then you can do and perform this good thing on her or him. But if you are want to do abdominal diagnose, then you need a sleeping bed. So this is very good thing for you all. You must familiar with the neck diagnose.
Hello, Prof.
Yes.
Please, sir, my network has been fluctuating, but I want to let me clear something.
Yeah. Ask me your where you are not understand.
Okay, sir. As regard of the neck diagnosis and the abdominal diagnosis, you know when you taught us the other the abdominal diagnosis,
Abdominal
when we
diagnose when
when
when you are
when we
perform.
palpate, I want to ask
Yeah.
a question. If we palpate, and for example, we see that the liver
Yes.
is the liver organ is having problem, you said we should find it on the scalp and needle that place, right?
Yes.
Okay, now is it the same thing when it comes to the neck diagnosis?
Then also you have to put needle on scalp area.
Yes. Is it the same thing? For example, the abdominal diagnosis, if for example it's liver, I will go to the liver channel on the scalp and put needle. If it's like that on the neck also, will I still do the same thing on the liver also?
No,
Is it the
no,
same thing?
no. If you see when you are going for a liver, then here is the yin and yang. And when you palpating this point, and this is tender point or very painful point, then if we see the liver organ is disturbed and there is yin and yang, it decide on the tenderness or softness of muscles. Then you can use the seduction point and tonification point also for the same organ. According to TCM theory, when you find liver point is in young aspect, then you tonify the points of liver organ. There are seduction and tonification point in the body. Then you can use those points. Any other question?
Hello, Prof.
Yes, Dr. Muskan.
Now, is there any certain point, a certain distance between these points? You see, in the neck diagnose, the urinary bladder is below the kidney. But when we go to this scalp, the scalp point, so is there any certain distance between the points in the yin and yang?
When you are see, this is yin side and this is yang side, and the point is on the same location.
Yes.
For diagnose near the clavicle bone. Okay. And
Okay,
this is
sir.
a triangular fossa in the near. This is a triangular fossa. And this is the this muscle is scalene muscle. When just front side of the shoulder, when you pushing down, if the muscle is very hard, then you have to use both point kidney. It is urine bladder diagnose, and you have to push on this point like this. In this, like this. When you are pushing like this, there is the point urine bladder, and when you pushing area like this, then there is, when you're pushing like this through the air arrow, then there is the kidney point. On back side like this, it is the point kidney point. On downside, it is the point urine bladder. I make again it. For kidney, like this. And for urine bladder, you have to go like this, down. Now it is clear to you, Dr. Muskan?
Yes, it's clear. Thank you, sir.
Okay. Then another point. Then I am going for ZS point. Okay.
Hello, Prof. Please, I have question. Hello, can you hear me? Hello, Prof.
Then at this junction of sternocleidomastoid junction and sternum head junction, here is the point ZS. ZS point. Okay. Then how you find this point? When you are going 1 centimeter down from this line and 1.5, it is 1 point and 1.5 here. Then here is the point ZS point. It is 1 centimeter and it is 1.5 centimeters. Centimeters. Okay. On yang side, the point is when you are going for here, just above, this is the center of here. And when you are going here and you make a line from here to directly above. Sorry. Go down this. When you see on this area, there is a notch. And when you go for center of this line, then here is the point ZS. Another way you find it, when you are going for this line directly on the area of lumboidal and temporal bone and parietal bones suture area on mastoid bone. Here is mastoid bone, then occipital bone, then parietal bone. Junction of 3 sutures is approximately here. And when you go straight up, then this point is the midway of this line. Here is the ZS point. Okay. And you can use this point for all gynec problems. With the other problem is Parkinson problem. Yin and yang point. I make a chart and send you for ZS point special for ZS point. I will share with you. Because here I am not able to draw a straight line. I try, but it is not sufficient. Okay. Here is the point. You see, this is ZS point. So it will make like this. And when you are going straight down from here, then it is here. This is the front ZS point, and this is the yin side, and this is yang side ZS point. Now it is clear to everyone.
Hello, Prof. I have a question.
Prof, what did you call this last point you give us? The last point you do. What is the name of the last point?
ZS.
And if I may get it clear, sir, you said it is used for gynae problem and what else?
ZS point.
Parkinson's. Okay,
Yes.
thank you.
For Parkinson.
Hello, Prof. I have a question.
Yes.
Yeah. When you were explaining the kidney and then urinary point the other time, you mentioned something like sedating and tonification. Can you please explain the two words and let me see what it is? Thank you, sir.
Okay. I am telling, when you are using a diagnose point and you are doing a diagnose, 1 minute. Now you have to clear all the points here, but you are asking about what I am saying. When you find all these points in diagnose and you want to use the law of TCM acupuncture. In TCM acupuncture, you all know there is a sedation point and tonification points of every channel. Okay. When you find this muscle is very soft, then you have to use yang side. Then you need to tonification. And when the point is very hard, then you have to use yin, yin sedation. You have to need sedation. I'm telling this.
Prof.
Now it's clear to you all?
Prof.
Yeah.
If
Excuse me, sir.
Is it going to be any problem if we use the yin and yang at the same time?
No. You can use some points on yang side, some points on inside. Like this, when you are using lever point, then it is the muscle is very hard and you have to need inside. But when you are going for Sengio, then it is very soft and very sensitive. Then you have to use yang side. It is not necessary. You are do all the points on the inside, or you use also all the points on yang side. When you are palpating the heart point, the muscle is here is very soft, but point is very tender. Then you have to use yang side. But if the muscle is very hard, like liver, then you have to use yin side, this point.
Good evening, sir.
Yeah, good evening.
Yeah, thank you very much, sir. Still on the tonification and sedation, sir. In TCM, what I understand about the tonification and sedation, tonification is needling on the direction of the energy, while the sedation
Yes.
is needling against the direction of the
But
energy.
there is some point. There is some point for tonification and sedation.
Okay. Is this
Because
same principle that is applied to this
I
one
told
as
you
well?
one thing very frankly. I do almost scalp acupuncture. So I am not remember which point is tonification and which is sedation point. But I told you all the Jingwell point and Hisa point. Yuan source point is used for the points. If you are using a Yuan source point of yin, then it tonification, it's yang. Oh, sorry, it's yin, but paired organs yang. See, on one palace it is doing sedation, and on one palace on other paired organ it is tonification. And I will clear you everything tomorrow. No problem. I will tell you all the points: seduction and tonification point, and when you have to use yuan source, and when you have to use Leo connecting point, then back shoe point and front shoe point, front mu point. I will share you with my notes. All my notes I will share with you. Okay. Now any other question?
Yes, I have a question here, sir.
Yeah.
When it comes to the treatment, can moxa before needling or even while the needle is on, can one moxa? Is it necessary?
Repeat your question, my sister.
My question goes like this. If the place is hard and tender, can one moxa before needling, or one will still needle and then moxa at the same time? Is it possible?
Same time there is no problem, but in scalp acupuncture there is no need of any moxa. And
Okay,
if
sir.
you are
Thank
using,
you, sir.
if you are not using needles and you want to stimulate the point, then you can use moxa, no problem.
Okay, sir. Thank you, sir.
Yeah.
Hello, Prof.
Yes,
Please,
my
In,
sister.
we're rounding up
in
the
sponsor,
questions. Let's learn to observe the time. This is 6:13.
sorry, please. In scalp acupuncture, do you stimulate? Do we stimulate when you needle?
In scalp acupuncture,
Yes. When you needle the head region, do we
yes.
stimulate? Do we stimulate with a
Yeah.
stimulator?
We stimulate in YNS, there is no need of any stimulation, but if the patient feeling pain, then you have to redirection the needle. Don't remove needle, push it back and redirection. Otherwise, you stimulate it 1 or 2 times, about 2-3 rounds, like this. Then left it. The pain is gone.
Okay, thanks you, sir. When you now needle the head region, for how many minutes will you keep the needle there?
30 minutes.
30.
Yeah, 30.
Thank you.
If the patient in my observation, then I put it for 3 hours. No problem. If the patient want to go, then remove needles. If the patient is in your observation, then there is no need of remove needles. There are so many other techniques in acupuncture field. That one we read all. Okay. Now I want to share with you something.
Hello, Prof.
Yes.
Well done, sir.
Now I remove this.
Prof, this is 6:15. It's 15 minutes past 6.
Yes, yes, miss.
Okay, sir. Because we agreed to work with the 1 hour time, sir.
Yes, yes, my sister.
All right, sir.
Can I take 2 or 3 minutes, my sister?
Okay, Prof.
Then I want to share. This is the university's fees structure, which I am telling you. And in this university, there are school of arts and school studies, then a school of science, then school of library, school of foreign language, school of education and physical education, then school of law, mass communications, then school of commerce and management, a school of computer science, then school of engineering. There are so many engineering courses. We have to do all the course in paramedicals. School of Paramedical Science, Diploma, UG and PG courses. Then there is some courses. Those I am telling you for course advisory. Then you can see here is BPT. It is 4.6 year course, and it is +2 with PCP. Then for diploma in physical therapy, then it is 3 year, but it is 12th base. There is no need of PCB. Then another diploma I can tell you for BSc course. Then there is another one is Bachelor of Physiotherapy. That is here. It is also on PCB 4 year course, and 40,000 per year is fees structure. Then another course I will show you. Occupational therapy. I am not suggest you. And here is a course 41. You see, BSc in Acupuncture Medical Science. I highlight it. On frequency of 42. On 41. Now, this is the course after +2. After secondary examination, the fees is 22,000 per year. It is the course of 4 years. Then there is a postgraduate diploma in UC on 67 frequency. Then there is fees of 50,000. It is 1 year diploma, postgraduate diploma in acupuncture course. So I suggest BSc in acupuncture or postgraduate diploma in acupuncture. There are diploma also in Panchkarma on 65. Here is the diploma in Panchkarma on 65. 25,000 is fees for 1 year. So if anyone want to gain this certification or diploma courses, then they tell me. There is no hidden charge and no other charge. This is university fees. I am not taking anything. I will teach. If you are doing 1 year postgraduate diploma, then I will teach you Panchkarma and all things. If you are want to doing BSc, then we have 4 years to read continuously. Then we will do in this 41 frequency medical course for 4 years. Then we can do in this physiotherapy and yoga and naturopath, then Ayurveda pharmacy and everything, because it is a very long time. You can pay in installment. There is no necessary. You have to pay in many installments. it is on you which degree you want to do. I suggest you BS in acupuncture medical science. Then second is diploma in Panchkarma or diploma in acupuncture. 1 year course. And it is valid in India and in abroad also. Okay.